Hey guys, this is Manu, physical therapist and Ayurveda herbalist. So today I'm going to show you a massage technique for quadriceps tendonitis or tendinosis or any other kind of degenerative stuff that's going on, or thickening, or the tendon is scarred down. So let me just show you a little bit of the anatomy where things are, and then the massage technique itself. So here, your quadricep is the muscle that sits on top of the knee. Okay, your quadricep tendon is going to be just at the base of that. So your quadricep muscle, your quadricep tendon is right here, attachment point to the top of the kneecap, and then it tapers down and your patellar tendon down here. So we're going to be looking at addressing problems going on right through this region. So quite often, because of an injury, or you twist your knee, or even sometimes after impact, blunt impact, or some kind of contusion, things get scarred down and bound up through here. You can get, of course, as I said, tendonitis or tendinosis type stuff too. So easy massage techniques, cross-friction massage technique. So I'm going to show you, actually I'll show you on this knee itself. So as I said, your quadricep tendon is right here. And here's the kneecap, top of the kneecap, here's the tendon itself. So easier way to do that is, and you don't want to do, I'm not going to do this in a stretch position, you want it in a slack position right through here. So I'm going to use the heel of my hand, and I'm going to put direct pressure on that, and I'm going back and forth essentially, okay, across the fibers. The fibers are going down this way, we're going across the fibers. Okay, so you can either do this, or I can use my fingers. I stabilize the index finger with my middle finger, and I search the tender spots and I work through it with direct pressure on it and going across the fibers. Not comfortable, but very effective though. Now remember, you're not just massaging the skin. This is not going to do anything. You have to put direct pressure on it and go back and forth, steady motion. Okay, so about between 5 and 10 minutes. You might have to go further out. You might have to come back to the inside of the muscle belly, okay, or the tendon itself. So kind of search your way around and find the tender or thickened spots. Okay, so that do the cross friction first, and then another thing that you can do is, which is quite effective, is doing a tack and stretch or a pump massage technique. So I'll show that on this leg though, and I'm going to use an herbal oil, and this is called Restore. Very effective. It's an Ayurvedic herbal oil that I use for a lot of my patients, and it works quite well. So there's about 40-50 different herbs in it. Very effective for improving circulation, for pain, and just helping the tissue heal. So I'm going to just massage that in through here, all the way up to the mid or upper part of the quadricep muscle too. So on both sides, all the way through there. Now the actual technique, of course I can go strum the muscle all the way up the chain, right? Not just distally where we're trying to address the problem, which is right through here. So as I showed you earlier, its cross friction is like this. Once that's done, and then I can take the, and I can, for example, put it right here, and I can tack it down. And remember, you can do this in sitting also. The person will be sitting up, you're sitting down, and you're tacking it down, and you're pushing this down. Tack, push down. So I'm essentially tacking the muscle down, the tendon down, and I'm pulling the lower leg down, so it stretches it. Tack it down, and so up to different directions, so it improves the extensibility, flexibility of the tissue, breaks down adhesions and thickening, improves circulation, blood flow to that tissue too. All the way up the chain. So go all along there, your IT band also. So essentially you get everything along that area. So it's quite effective. And of course, when you're sitting down, you can take the leg even further down. So the other way would be if I were to bring it to here, and I could always tack it down, and I can still do that. Tack and stretch, tack and stretch. So slacken it, tack it down, stretch, tack and stretch. So more effective in sitting, but with a 90-degree position. But this one works quite well. If I'm here, I tack it down and I work through there in different positions. Okay? So these two techniques are quite effective in addressing that problem. Okay? So if you have any questions, please leave a comment. Make sure to click on the link below. It'll take you to my site, and you can get lots of information on knee problems and just overall rehab and fitness. And subscribe to the channel, and I will share some more stuff with you guys soon. Thank you.